Hey everyone, welcome back. Today we're diving deep into a topic that's crucial for any aspiring orthopedic surgeon, especially those of you prepping for those tough postgraduate exams, like the FRCS, ligaments and tendons.
Oh, yeah, those are essential.
We're going to break down these structures in a way that's clear, concise, and hopefully a little bit fun. Now, to guide us through this, we're using the Ortho Made Simple notes from mokyingren.sg.
Okay.
These notes were put together by Dr. Mokyingren.
Oh, I know Dr. Mark.
Yeah, he's a sports surgeon from National University Hospital in Singapore.
Uh-huh.
And he actually aced his FRCS back in 2022.
Well, that makes sense then.
So we're in good hands, so to speak. Okay, let's jump right in. We know ligaments connect bone to bone,
Yeah.
and tendons connect muscle to bone, right?
Right. Anatomy 101.
But what really sets them apart? I mean, why is understanding these differences so crucial for us in the OR?
So it all boils down to their composition and how they're structured. Both are made primarily of collagen, but ligaments, they have a little secret weapon.
A secret weapon? Elastin.
This extra elastin gives them flexibility and that springiness that's needed to stabilize joints so they can stretch and recoil as we move.
So ligaments are like what, the flexible bungee cords of our joints?
Yeah, that's a good way to put it.
And tendons are more like the strong cables that transmit force.
Exactly. And if you look at the collagen fibers under a microscope, you'll see that ligament fibers have this wavy, crimped pattern, which lets them handle forces from multiple directions. Tendons, on the other hand, have very tightly packed parallel collagen fibers for maximum strength when those muscles contract.
Makes sense. So as surgeons, we need to think about these structural differences when we're diagnosing injuries, right?
Absolutely.
Planning repairs and just choosing the right surgical techniques in general.
Every step of the way.
Now, this next part always fascinated me. Collagen synthesis. It seems almost magical how these tiny building blocks come together to create such strong and resilient tissues.
Yeah, it's quite a process.
Can you walk us through that?
Okay, imagine you're building a suspension bridge.
Okay.
All right, you start with a blueprint, right?
Sure.
Which in this case is our DNA.
Our DNA.
That DNA holds the instructions for making collagen, but it needs a messenger to carry those instructions to the construction site.
So who's the messenger?
That's where mRNA comes in.
mRNA, okay.
Yeah, the mRNA molecule, it transcribes the DNA code and carries it out of the cell's nucleus to the ribosomes.
It's the ribosomes.
Which is where proteins are synthesized.
So DNA is the master plan, mRNA is the messenger, and ribosomes are the construction workers.
You got it.
Awesome. And what are these workers constructing?
Polypeptide chains.
Polypeptide chains.
Which are the building blocks of proteins. These chains then twist together, kind of like strands of a steel cable, to form a triple helix structure.
The triple helix.
Called triple collagen.
Triple collagen, okay.
Multiple triple collagen molecules link together, and that forms those strong collagen fibrils, which then bundle together to form the final tendon or ligament structure.
Wow, so it's like weaving together countless tiny cables to create these incredibly strong structures.
Yeah.
It's mind-blowing how organized this process is. Now, I remember from anatomy class that these tissues aren't just collagen.
Right.
What about the water and cellular content? How do those compare to other connective tissues we see, like bone or cartilage?
You're right. It's not all about collagen. Let's take water, for example.
Okay.
Tendons and ligaments are about 65% water, which is similar to menisci, but much lower than cartilage.
Oh, really?
Yeah, which is around 75% water.
Okay.
This difference reflects their function. Cartilage needs that extra water to act as a shock absorber.
Right.
While tendons and ligaments, while they need some flexibility, they prioritize tensile strength.
Got it. So the more water, the better it is at handling compression.
Exactly.
That makes sense, especially when you think about how much force our joints experience. What about the cells within these tissues?
Tendons and ligaments have a surprisingly high cellular content, about 20% fibroblasts.
20% fibroblasts.
These are the cells responsible for producing and maintaining that all-important collagen matrix. It's a much higher percentage than you'd find in bone or cartilage.
Interesting. So more fibroblasts mean these tissues are constantly being remodeled and repaired?
Exactly. It highlights just how dynamic these tissues are. They're not static structures. They're constantly adapting to the stresses and strains we put on them.
Speaking of unique structures, there's one ligament that always stood out to me in anatomy class, the ligamentum flavum. I remember being struck by its yellow color. What makes it so different?
The ligamentum flavum gets its color from a high concentration of elastin.
Ooh, elastin again.
About 75% compared to other ligaments.
Wow, that's a lot.
This abundance of elastin makes it incredibly flexible and resilient, allowing it to support the spine's movements.
It's like a super elastic band helping our spines bend and twist. Now, shifting gears a bit, let's dive deeper into the world of tendons. They have this fascinating layered structure that's important to understand, especially when it comes to injuries and healing.
Absolutely. From the inside out, you have the endoton surrounding the collagen fiber bundles, then the epitenon encasing the entire tendon, and finally, the outermost layer, which can either be a peritonon or a synovial sheath. This outermost layer plays a key role in the tendon's blood supply, and consequently, its healing potential.
So, some tendons have a better blood supply than others. What are the implications of that for us as surgeons?
Exactly. Synovial sheaths, like those we see in the flexor tendons of the hand, have a rich blood supply, which promotes faster healing. On the other hand, peritoneal tendons, like the Achilles, rely on a less robust blood supply from nearby muscles.
So, a good blood supply is generally a good thing for healing, right?
For the most part, yeah, but it's not just about the amount of blood flow.
Oh,
The source of those healing cells, the fibroblasts, also matters. In sheath tendons, fibroblasts mainly come from the tendon sheath itself, which can lead to more scarring and adhesions during healing. Peritoneal tendons get their fibroblasts from the tendon itself, usually resulting in less scar tissue and better overall healing.
wow, I never realized the source of those fibroblasts could make such a difference. Can you give us some examples of common sheathed versus peritoneal tendons? Ones we encounter in our practice.
Absolutely. Think of the tendons in your hand, the flexor tendons,
Hmm.
the ones that allow you to grasp and manipulate objects. Those are classic examples of sheathed tendons. Now, picture the Achilles tendon, that thick cord at the back of your ankle. That's a peritoneal tendon.
So those sheathed tendons need that extra protection as they glide through those tight tunnels in our hands. Now let's talk about how tendons and ligaments attach to bone.
That's where insertion points come into play, and we have two main types: direct and indirect.
Okay, break it down for us. What's the difference?
Direct insertions are like a seamless bond, where the collagen fibers of the tendon or ligament interweave directly with the bone's fibers. Think of the MCL in the knee or the deltoid tendon in the shoulder.
Yeah.
Indirect insertions, however, involve a gradual transition zone. It's like a carefully crafted gradient, where the tendon or ligament blends into the bone through four distinct zones.
4 zones. That sounds pretty complex.
It is, but imagine it like this. In zone 1, you have those parallel collagen fibers of the tendon. As you move into zone 2, those fibers start to mix with unmineralized fibrocartilage.
So it's like a blending of the two, creating a smoother transition from tendon to bone.
Precisely. Then, in zone 3, we encounter mineralized fibrocartilage, making the tissue even tougher and more bone-like. Finally, in zone 4, that mineralized fibrocartilage merges seamlessly into the cortical bone.
Amazing. It's fascinating how nature designed this gradual transition from flexible tendon to rigid bone. And it makes me wonder, what happens when those connections are injured? How do tendons heal after, say, a significant tear?
Tendon healing is a multi-stage process, usually involving 3 distinct phases: inflammatory, proliferative, and remodeling.
Let's break those down step by step. What exactly happens during that initial inflammatory phase?
Immediately after an injury, blood clots form and inflammatory cells rush in to clean up the damage. This phase is crucial for kicking off the healing process. But it's also when the tendon is at its weakest, reaching its lowest point around 2 weeks post-injury.
So those first 2 weeks are critical for protecting that injured tendon.
Absolutely. As the inflammation subsides, the proliferative phase begins. This is when our busy fibroblasts start laying down new collagen fibers to bridge the gap.
So new collagen is being produced to repair the tear.
Exactly. But it's not the same type of collagen found in a healthy tendon. Initially, it's mostly type 3 collagen, which is weaker than the mature type I collagen. It's like building a temporary scaffold.
Makes sense. That's like laying down a foundation before you start building the stronger, more permanent structure.
That's a great analogy. And over time, as we enter the remodeling phase, that weaker type 3 collagen is gradually replaced by the stronger type I collagen. This phase can last for months, and it's during this time that the tendon slowly regains its strength.
Okay, so a gradual process of rebuilding and strengthening. But I imagine a lot of factors can influence how well a tendon heals, right?
You're absolutely right. Intrinsic factors like the patient's age, overall health, and underlying conditions like diabetes can impact healing. Extrinsic factors related to the injury itself, like the severity of the tear, its location, and joint stability, also play a role.
And of course, we as surgeons have a huge impact on healing as well, right?
Of course, our surgical techniques, suture choices, and postoperative care can all significantly impact how well a tendon heals. We're part of this intricate healing process, guiding it along the way. Now, speaking of tendons and their ability to handle tension, is there a way to visualize their strength? Absolutely. We use a stress strain curve to illustrate how tendons and ligaments respond to different forces.
I've seen these curves before, but I've always struggled to understand their practical implications. Can you break it down for us? What does this curve tell us? And how does it relate to our work as surgeons?
Imagine a graph with force on one axis and deformation on the other. At the beginning of the curve is the toe region,
Toe region.
where the tendon or ligament stretches easily with minimal force. It's like taking up the slack in a rope.
So the initial stretch is easy, then things get tougher.
Exactly. Next comes the linear region, where the tissue stretches proportionally to the force applied. This is where the material behaves elastically, meaning it'll return to its original shape when the force is removed.
Okay, so far so good. But I imagine there's a limit to how much these tissues can stretch before things start to go wrong.
You're exactly right. And that's where the yield point comes in. This is a point where the tendon or ligament starts to experience permanent deformation.
So exceeding the yield point means permanent damage.
Essentially, yes. Beyond the yield point, individual fibers start to fail, and we see those characteristic dips in the stress strain curve.
So those dips represent points where the fibers are giving way.
And despite some fibers failing, the overall stress can continue to increase until it reaches the ultimate tensile strength, or UTS. This is the maximum stress the material can withstand before it completely ruptures.
So understanding this curve is crucial for knowing how much force a tendon or ligament can handle before it fails.
Precisely. And it's particularly important in surgery, where we need to ensure our repairs are strong enough to withstand the forces those tissues will experience during healing. Now, there's one more crucial concept we need to discuss.
Okay, hit me with it.
Viscoelasticity.
Viscoelasticity. I remember hearing that term, but never fully grasping what it means. Can you enlighten us?
It sounds complicated, but it's a very intuitive concept. Viscoelasticity means that the mechanical properties of materials like tendons and ligaments change over time. They exhibit both viscous and elastic behaviors, almost like a combination of spring and, well, something else entirely.
Okay, so they're not just simple springs. What's a good real-world analogy for this?
Think about silly putty. If you quickly press on it, it resists the force like a solid. But if you apply constant pressure, it slowly starts to deform, showing its viscous behavior. Let go, and it slowly returns to its original shape, demonstrating its elastic nature.
Okay, that makes sense. But how does this apply to tendons and ligaments in the real world, especially in our clinical practice?
It has a huge impact on how we approach diagnosis, treatment, and even rehabilitation. Let's look at a couple of examples.
Okay.
The first is creep. Where a material deforms over time when a constant force is applied, think of it like slowly stretching a rubber band. It will continue to lengthen even if you hold it at a constant tension.
Interesting. So that's creep. What's the other example you mentioned?
The other one is stress relaxation, which is essentially the opposite of creep.
Okay.
In this case, the material is held at a constant length, and the force required to maintain that length decreases over time. Picture a surgeon preparing to insert a hip replacement stem. They might apply a controlled force to the bone to create space, then wait a few moments before hammering the stem into place. This waiting period allows for stress relaxation in the bone, making the insertion easier.
So understanding viscoelasticity means recognizing that these tissues aren't static.
Right.
They're dynamic and constantly responding to forces over time.
Precisely. And as orthopedic surgeons, we need to be mindful of these properties in everything we do, from the way we diagnose and treat injuries to how we design rehabilitation programs.
This has been an incredibly insightful deep dive into the world of ligaments and tendons. I'm already feeling much more confident about tackling those challenging exam questions.
Me too. It's amazing how much we can learn when we take the time to truly understand these fundamental structures.
And remember, everyone, these insights come straight from the OrthoMate Simple Notes on mokyingren.sg, an invaluable resource for any orthopedic resident.
I can't recommend them enough. They were instrumental in my FRCS prep.
We'll be right back after a quick message to continue our deep dive into ligaments and tendons. Stay tuned. Welcome back to our deep dive into ligaments and tendons.
We're just getting started. There's still so much to explore.
You mentioned viscoelasticity before, and I have to admit it's a concept I've always found a bit tricky.
Yeah, it's one of those things that seems complex on the surface, but once you grasp those underlying principles, it all starts to click.
Okay, I'm ready to have that aha moment. You explained creep and stress relaxation. Are there any other key concepts related to viscoelasticity we need to know, for our exams and, more importantly, for our future practice?
Absolutely. One more phenomenon linked to viscoelasticity is hysteresis.
Hysteresis. Okay, now you've really lost me.
All right, think about what happens when you stretch a rubber band.
Okay.
You hold it for a moment, then let go.
Uh-huh.
Feels slightly warmer, right?
Yeah, yes, sir.
That's because some of the energy you put into stretching it is lost as heat.
Okay.
That energy loss is hysteresis.
So some of the energy is dissipated as heat.
Exactly. And believe it or not, this energy loss is actually beneficial in our bodies. It helps dampen vibrations and protect our joints from excessive stress.
Wow. So it's like a built-in shock absorption system.
Precisely. And understanding hysteresis helps us appreciate how tendons and ligaments adapt to different loading conditions over time. This is particularly important when we're rehabilitating patients after an injury.
That makes a lot of sense. We need to gradually increase the load on those tissues, right? To help them regain their strength and resilience.
Exactly. And by understanding the concept of hysteresis, we can design rehab programs that are both effective and safe.
Listening to you explain all this really highlights how interconnected everything is. It's not just about memorizing facts. It's about understanding these underlying principles and how they apply to real-world clinical scenarios.
I couldn't agree more. That's why I love this approach to learning. It's about connecting the dots and seeing the bigger picture.
Speaking of the bigger picture, I'm curious to get your thoughts on where this field is headed. We've talked about the basics of ligaments and tendons, their composition, how they function, how they heal, but research is constantly evolving.
It is, and it's incredibly exciting.
What do you think the next big breakthrough in tendon and ligament research will be? And how will it impact our practice as surgeons?
That's a great question. It's tough to predict the future, but I think we're going to see some major advancements in tissue engineering and regenerative medicine.
Yeah, I've heard about some really promising research in those areas.
Right now, we're limited in how we can repair or replace severely damaged tendons and ligaments. But imagine a future where we can use bioengineered scaffolds to guide tissue regeneration, or even implant lab-grown tissues that perfectly match the patient's own anatomy.
That sounds almost like science fiction.
It does, doesn't it?
Yeah.
But it's closer than you might think, and it has the potential to revolutionize how we treat these injuries, improving outcomes and getting patients back to their active lives faster.
It's truly an exciting time to be entering this field.
Yeah.
And all this knowledge we've been discussing, it's not just theoretical. It's foundational to making informed decisions in the OR and providing the best possible care for our patients.
Absolutely. And as you said earlier, it's not about rote memorization. It's about understanding these concepts deeply so we can apply them critically and creatively.
Couldn't have said it better myself. And for those of you listening who are preparing for your postgraduate exams, remember, this deep dive is based on the OrthoMade Simple Notes you can find at mokyingren.sg.
They're a fantastic resource, particularly if you're a visual learner like me.
We'll be back after a short break with one final thought to leave you pondering as you continue your journey to becoming exceptional orthopedic surgeons. Stay tuned. We're back for the final part of our deep dive into ligaments and tendons.
It's been quite a journey, hasn't it, exploring all these essential structures.
We've covered a lot of ground, from their composition to how they function, how they heal, all that.
And how they respond to forces, don't forget that.
You're right. You're right. It's amazing how much complexity there is in these seemingly simple structures.
Oh, absolutely.
And for all you future orthopedic surgeons out there, don't forget, all this comes straight from the OrthoMade Simple Notes, which you can find on mokyingren.sg.
They're a lifesaver, especially for those exams.
Okay, before we wrap up, I want to leave our listeners with a little something to ponder. We talked a lot about how we care for ligaments and tendons now, but what about the future?
Ooh, good question.
What advancements or breakthroughs are you most excited about? And how do you think they'll change how we approach these injuries in the years to come?
That's a tough one. There's so much happening. I think, though, if I had to pick one area, it would be the intersection of biomechanics and personalized medicine.
Interesting. Tell me more.
Well, we talked about how important it is to understand the mechanical properties of these tissues, right? How they respond to stress, how they heal, how those properties change over time.
Yeah, definitely. And you mentioned personalized medicine earlier.
Exactly. Imagine a future where we can use like really advanced imaging and even genetic testing to create a model of a patient's ligaments and tendons, a patient-specific model.
So we'd have, what, a blueprint of their individual anatomy and biomechanics?
Exactly. We could use that to create a truly personalized treatment plan, whether that's rehab protocols, surgical techniques, or even predicting their risk of future injuries.
Wow, that would be incredible. Like taking precision medicine to a whole new level.
It really would. And it's not just about helping individual patients.
Right.
By collecting this kind of detailed data, we can start to see patterns, trends that lead to new insights into preventing injuries and treating them for everyone.
That's amazing. So we're not just treating injuries, we're shaping the future of orthopedic care.
We are. We really are. It's a very exciting time to be in this field. I can't wait to see what happens next.
I hear you. So to all our listeners, those hitting the books and prepping for those exams, remember, this deep dive is just the start.
It's a foundation.
Keep learning, keep exploring, and never, ever stop asking questions.
And never lose sight of how amazing the human body is. What these tendons and ligaments can do, it's truly remarkable.
I couldn't agree more. That wraps up our deep dive into ligaments and tendons. Hope you found it insightful and, dare I say, enjoyable.
It's been a pleasure diving deep with you all.
Until next time, keep learning, keep growing, and keep pushing those boundaries in orthopedic care.